We do know that nutrition is critical for a child between that 6 months and the first 2 years of life, which is the 1,000 days. For what that child will be, it's because our parents are giving all of us here in the first 2 years of life. That's why we are here to be able to be part of this meeting. So there are 3 powers of legislation, oversight, and representation. The legislative part is that they are the process. As far as we know, we don't have councils, but they are closer because they are one that is closer to our communities. We have federal legislators, senators, and House of Reps. They do have programs that they want to implement in our space. The Houses of Assembly are closer than them, and they will be able to engage through their local government to make actions to happen. So this is why this debate program is critically important.
This year, in 2024 rainy season, FAO supporting major food production by providing quality agriculture input for about 27,000 households, approximately 200,000 individuals. This support includes quality crop seed, fertilizer, and technical training.
This event marks a significant step toward addressing the critical issues of malnutrition and food insecurity that affect millions of people across Nigeria. This gathering is very timely given that the challenges posed by malnutrition and food insecurity has reached a critical point since it affects a significant number of Nigeria.
Today, as we inaugurate the National Legislative Network on Nutrition and Food Security, we lay the foundation for a unified and coordinated approach to tackling one of the most pressing challenges in our time. The stark reality presented by the 2024 Cadre Harmonies report underscores the gravity of the situation, with millions of our fellow Nigerians facing severe food insecurity and malnutrition. These statistics are not just numbers, they represent lives, families, and futures at stake.
We need more money for nutrition, but we need more nutrition also for the money that we have. The second, please show your support by participating in key events. Right now, we have a very important maternal newborn child health week happening in each of your states. Children are given vitamin A, deworming, women are given pregnancy supplements. Participate in those events, show that you care for our women and children.
The food insecurity in Nigeria has worsened. There is, however, cause for optimism. The optimism we share stems from the fact that for the first time, attempts to tackle malnutrition and food insecurity will have a legislative push. Furthermore, this legislative perspective will be driven collectively and holistically, anchored on the joint effort of the committee at the National and State Houses of Assembly, driven by a joint work plan with flexibility for incorporation of state-specific exigencies. This is the purpose for the formation of the National Network on Nutrition and Food Security, which is being created and will be inaugurated by the Right Honorable Speaker in this meeting.
Today, as we inaugurate the National Legislative Network on Nutrition and Food Security, we affirm once again our commitment to working collectively towards a common goal: the eradication of malnutrition and the promotion of food security across our great nation. Of course, we understand that this is a very challenging prospect to actually eradicate it, considering the statistics and the data that we've heard today, Nigeria being the #1 deprived country in the whole of Africa when it comes to nourishment for our kids, ourselves, and our future.
Food security and nutrition, as we all know, are key pillars of Mr. President's Renewed Hope agenda for Nigeria. And this is a long-standing issue. For many years, we've struggled with stunting, we've struggled with maternal malnutrition, acute malnutrition, household food insecurity, but also the other side of overnutrition. The undernutrition is what we pay most attention to, and it's acute, and we need to deal with it. But in reality, we have a triple burden of malnutrition in Nigeria.
There are a number of federal government, state government, local government, I dare to say, and development partner programs that can achieve more results if they are monitored and evaluated and distributed on a ward-based basis. That is why the ministry is at the forefront of developing a ward-based delivery system and governance system. And with the assistance of the World Bank, we are currently in the design stage of what is called a HOP program, HOP Health, HOP Education, and HOP Governance. And the idea is that in each geographical ward, we should be able to identify needs. We should be able to see opportunities. We should be able to see what programs are operating, what programs are duplicious, what need is there that is met. Maybe it is a fishing community and we are trying to support them to become farmers.
Persistent violence, including armed banditry and kidnappings, which displays large population and disrupted livelihoods, early marriage, high childbirth rate, and climate change and environmental challenges are amongst the factors leading to the surge of malnutrition in Nigeria. Other identified contributors to malnutrition include lack of coherent policy framework, absence of sustainable funding mechanism, and growing dichotomy between the Northeast and other zones, which is created by international humanitarian organizations. Despite these challenges, there are ongoing efforts by state and non-state actors to ameliorate the rising nutrition crisis in Nigeria. The federal government, through the National Council on Nutrition, which is chaired by His Excellency the Vice President of Nigeria, and saddled at the Secretariat of the Ministry of Budget and Economic Planning, and stakeholders are partnering to provide solutions for the malnutrition crisis in Nigeria. This is why the Federal Ministry of Agriculture and Food Security is working through the Nutrition Council of Nigeria and spearheading efforts to promote nutrition-sensitive agriculture within the broader agri-food system.
This plaque, the National Legislative Network on Nutrition and Food Security, inaugurated by the Honorable Speaker on the 22nd July 2024. This plaque is presented to the Right Honorable Abbas Tajuddin, PhD, CON, Speaker, House of Representatives, National Assembly, Abuja, as the patron of this network on today, 22nd July 2024. Congratulations, sir.
We have key interventions that can be implemented easily. One of them is just at first to address the immediate needs of people who are hungry. We have 114 million people who need food assistance across the country. For those people, they cannot wait for a long-term solution. They need food now. We should improve also access to land in areas where people have been displaced because of insecurity. We have more than 2 million internally displaced people in Borno, around 1 million in Yobe State, and around 500,000 in Adamawa.
Generally, CH is done, although it is done at a point in time, but it usually classify people in two: the current situation and the projected situation. The current situation usually is a situation when the analysis is being done, while the projected situation is what we call the lean season, which is usually between June and August. Between June and August, this is a period where food prices are at their peak, obviously because there is depletion of food stocks, and that depletion now in the markets also reduces the quantity of food that is in the market, and this now gives rise to rise in price.
There are a couple of these companies that have started establishing industries in this country that are using food as raw materials. Like there is one in Benue for production of ethanol, and the raw material they use is cassava, and they use, in fact, the whole cassava that is produced in Benue, if we even give it today, it will not even be up to 25% of what they need. They go as far as Niger State, Plateau State, Nasarawa State to import cassava. They go to Taraba to bring cassava also. So I don't know, if there is no massive production and these raw materials are competing heavily with what the humans are taking, is there no need to have a legislation to guide that?
My name is Honorable Moses Estienne. I'm Chairman, Nutrition and Food Security at Akwa Ibom State House of Assembly. My question is for the presenter of the representative of Mr. Davidson, Nutrition and Food Security in Nigeria, building resilient and sustainable system. And now in the data presented, the resource person makes us to understand that 1.8 million people, provisions have been made for 1.8 million people in need. And then it went back as saying that these are the vulnerable people in Nigeria that the World Food Program make adequate provision for in Nigeria. My question is, how do you determine the vulnerable people to the tune of 1.8 million in Nigeria? And where is that generated from? And how many people are from Akwa Ibom State that I come from?
Government, particularly at the federal level, particularly the National Assembly, I think there should be a legislation or an engagement with the CBN to see how we can create a friendly economic policy that will reduce the interest rates in this nation so that it can encourage a lot of people to go into farming. I can tell you, farming, as we all know, is the only industry that can create employment opportunity, that can reduce the lot that we are facing as a nation. But if we are serious about it, I think it is time for us to look at the holistic approach to the issue so that we can be able to address this very important document.
Our major concern in rural areas, we are not getting fertilizer in a good time. You are expecting to get fertilizer by early March, April. You can't get it until. So this is a very serious problem. So this issue too, as a legislature, I think we are supposed to put it together to liaise with the National Assembly to make an effective way out, so that to make sure that our peasant farming can get their fertilizer in a good time.
The issue of access to farm inputs, modern farm inputs, I think is another thing that our government has to look at. Then majorly the issue of land crisis. It was a situation whereby in some part of the country, I think land grabbing has become the order of the day, whereby some people even believe grabbing the land for commercial purpose rather than using it for agri purpose.
When you talk about maybe food insecurity, what is usually considered, as said earlier, is those places that were already declared as an emergency areas where this issue is actually ravaging. So our efforts have actually been really in those areas. However, we are also looking at other areas in terms of classification of food insecurity, including the other states outside Northeast and Northwest.
If you ask me as a layman, I will tell you that two key factors that have deepened the challenge of food or that has made it difficult for us to have food. The number one is insecurity. Insecurity. And for those of us from the southern part of the country, it becomes worse because the food we eat, 80% of the food we eat come from the north. Whether you like it or not, this is the truth. Now, when you talk about food production, forget about the mechanized farmers, so those who have farms. They have a way of taking their produce and going out of the country. Talking about rural farmers who bring out their farm produce from the bush and go to the next local market, either daily market, or if you come to the part of those of us from southeast, the markets that come every 4 days. They are the ones that are actually supplying food that we are eating. Now, where are we? Those farmers are no longer able to move into the farmland and farm because of insecurity. Either the herdsmen go and kill them, or herders clash, or what have you. When I talk about insecurity as a major challenge, I also see multiple taxes and levies. Let me just explain it this way. The tomato that we eat in the north, in the south, is not grown in the south. The onion that we eat in the south is not grown in the south. The beef that comes from cow or goat is hardly grown there. It comes from the far northeast, northwest, and north central. Now, for the average farmer or average woman or man who sells these products, one way or the other, they go to the north. A lorry load of onion leaving Birni-Kebbi would have to pass through minimum of 12-13 states to get to Uyo, where you come from. True or false? One of the things that we were able to resolve in Owerri on the 2nd of May, particularly when the speakers came, was identifying this as a challenge. The market woman or man who goes to far away north and packs a truckload of food, say tomato, and then but his location is in Cross River State or in Cross River State, would have to pass through different states, and these states have local fees. Whether these monies end up in the coffers of the government or not, they stop these trucks, they task you, you pay. Sometimes if you don't pay, they vandalize your goods, and some of these people those goods are not even insured, so someone's means of livelihood is ended in one split minute. So part of the conversation we had in Owerri was that the states, because some of them claim that these things are backed up by local laws made by you, not by us, National Assembly. You're talking about legislation now. So there's a need for us to go and look at those laws that are obnoxious. I don't know how many of us saw in the last 2 years of Professor Ayade. I saw him crying on national TV, where he passed a law abrogating any form of fee or levy on those people who sell foodstuffs. I don't know if you remember. That's what we want to see. So that somebody goes to Birni-Kebbi and buys food, and the truck leaves. Nobody stops him or her on the way until he gets to the final destination.
What we call the critical window of opportunity is the first 1,000 days of life of a child, the period between conception and age 2, the second birthday of the child. And during this period, there is a very rapid brain development. This leads to cognitive, social, behavioral, also physical and mental development of the child. And early and consistent nutrition interventions, making sure that the pregnant woman eats nutritious meals, lead to the birth of a healthy baby. And during infancy, during toddlerhood, up till age 2, the baby is being fed with nutritious meals, exclusive breastfeeding where possible, and nutritious meals after that can lead to an extra or an added year of educational attainment.
We try to do some analysis sometime from 2022 into 2023 to say we have gone past more than half of the lifespan of this MFAN, the costed plan. So how are we doing in terms of that? Now, when you look at the MFAN costing year on year, you look at 2021, 2022, and 2023, you can have an idea of how much the nation should have spent. Now, this is focused on federal. So it means that in our budgets, we are not making sufficient provision for nutrition. When you look at allocations versus what the MDAs actually spent, you also see that there's a differential as well.
My question is to the Chairman Committee on Food Security. In my state, we only have Committee on Agriculture, which I believe this could be a department under Ministry of Agriculture. So the challenge is, in order not to have conflict of responsibility, are we going to make a law that we either promote this to an agency, or how do we engage without having conflict with the Committee Chairman on Agriculture and me coming in now as a separate body? How do we work? How do we synergize? Because this is important, we need to escalate it, but to what extent can we do it, sir?
So I want to believe that the Speaker of the House, in his wisdom, who brought into this idea and carved out the committee that you are chairing, would also find a way to ensure that the existing committees of agriculture and health don't feel threatened. All right? Okay, so where you have this situation is where people are not pursuing defined goal and objective. That's why you have this conflict. But where people are pursuing well-defined goals and objectives, what is the goal and objective? To put food on the table. Make sure that the food that is on the table is nutritious. That's objective.
I want to bring the ground rules. Each person is expected on the panel to briefly introduce themselves, and also to note that we'll be asking questions in turns. Mrs. Dumebi will take on some questions specifically to the UN entities, and I will be taking questions to the National Primary Healthcare Agency, FAO, and the Honorable Member. I do ask the following question. 1. What are FAO's initiatives in Nigeria to combat malnutrition? And 2, the follow-up question, how do these initiatives align with Nigeria's national health strategies?
What are the WFP's few long-term goals for addressing malnutrition and food insecurity in Nigeria, and how does it plan to achieve them?
I think we all agree that for us to be able to produce more food in the country, make food available and accessible, we need peace and security. That's how people can go back to their lands. That's how people can have access to livelihood opportunities. But once that is done, we need to support them to start producing what we consume. And the way we can do it is to help them with irrigation systems so that they can farm during the main season, but also during the dry season.
I do ask the following question. 1. What are FAO's initiatives in Nigeria to combat malnutrition? And 2, the follow-up question, how do these initiatives align with Nigeria's national health strategies.
If you identify certain activities, including provision of inputs for crop production for rainy and dry season, and also supporting processing of produce, one, to get income, and secondly, to ensure consumption of healthy and nutritious diets, and also FO is also supporting the production of livestock, aquaculture, and also poultry. All is geared to enhancing increased intake of animal-based protein.
For most states, House of Assemblies, the popularity resolves around the medium-term expenditure framework, and from the MTF, most of the states have done short-term plans, long-term plans. We need to look into the MTF, see how we can add value to areas of nutrition and food security.
I am also happy that we have honorable members from the states. So we need to work more with the primary healthcare board, because the responsibility of implementing primary healthcare delivery lies with the state primary healthcare board, the LGA, and the ward and the health facilities. So there is need for us to reactivate the ward development committees. Reactivate, just like Honorable Kafo said, our ward councillors, because they are the political advocates at that level. If we get it right at the primary health care, we will get it right at the national health system.
We want a situation where the high percentage of stunting and wasting that we have in Nigeria today is drastically cut down, and we produce healthy citizens that can contribute to the growth and the development of our country. There is no doubt that the literature and research are clearly affirmed and attested to the impact of a well-built human development. Human capacity development is seriously anchored on nutrition.
I love the word that was used: ignite challenges, ignite changes. These are some of the buzzwords that have come up to address security, food security, and the importance for us to be sincere. Once again, I want us to give a round of applause to the members and thank them for their very contribution. Thank you very much.
The motion for adjournment ably moved by the majority leader of Ekiti State House of Assembly and ably seconded by the majority leader of Bauchi State House of Assembly is before us. So I put the question. Those in support of the motion say aye. Those against say nay. The ayes have it.